In this lesson, we're going to talk about glucose. So the normal value of glucose is 70 to 115 milligrams per deciliter. It's going to depend on your facility and it may vary, or it may vary depending on the type of bedside testing that you use. And we're going to get into that later. But for the most part, this is going to be a normal value for your patient. And I'm sure that we're all really familiar about the importance of glucose when we're managing our patients, but I think we should go back to why that is. First off, glucose comes from the carbohydrates that we consume in our diet. We eat them and then they get broken down by our digestive system. And the reason we need glucose is when they're broken down and they go through glycolysis, so energy production, it's used for energy, and that energy, and it's the energy production unit for all of our cells. And this is where things get a little bit tricky. We have this hormone called insulin that we're all pretty familiar with and is produced in our pancreas. And then the reason we need insulin is because it is essentially the key to getting the glucose into all of our cells for cellular respiration. And let's go through this process just for a second. So you have this phospholipid bilayer here, right? And so this is the outer wall of a cell. And this unit right here is the insulin receptor cell. And there's an alpha unit and or alpha subunit and a beta subunit. And what happens is the insulin is produced by the pancreas and comes down and it fits into this receptor like a key. And then it activates the beta subunit and it opens. And then this whole cascade of events happens. What happens are these things called glucose transporters. So they look kind of like this. They get these little tubules here. Look like little aliens. But what happens is essentially this comes up here and inserts into the cell wall, opens up, and allows all these glucose molecules out here to come into the cell. That's pretty cool, right? So what happens if there's a problem with the insulin? Well, there's a couple of different things that happen. You can either have a problem with the production of insulin, so you've got diabetes. So you either have insufficient insulin, no insulin. So they don't have the ability to activate this receptor. And that's going to create these high levels of glucose in the blood where it shouldn't be, and because it needs to be inside the cell. So sometimes there's an actual problem with this receptor itself. And this is where you get things like insulin resistance. We'll get into that a little bit later. Either way, the glucose is on the outside of the cell where it shouldn't be, and it needs to be inside the cell. So for diabetics, this is where additional insulin comes into play because they have a problem with the actual insulin production. And by supplementing them with the insulin, it allows the insulin molecules to activate the cell and allow those glucose transporters to allow the glucose to move from the outside of the cell to the inside of the cell. So what do we need to be thinking about whenever we are doing our glucose labs? Well, first off, they're going to be in almost every one of your lab panels. So you're going to see them in your liver labs. You're going to see them in your chemistries. It's almost always going to be a default. The other thing you need to think about is when you submit it, most of the time you're going to submit it in this gray tube. Sometimes you'll submit it in a gray tube, but the green tube is going to give you a quicker result. The other time that you're going to actually do this is when you do bedside testing. So you're going to do your capillary blood glucoses or CBGs. And this is when you're responsible for checking the glucose at the bedside for your patients who need better glucose management. There's a whole lesson on glucose monitoring, so as well as the other endocrine disorders associated with glucose testing. So I encourage you to check all of those out. So when are you going to see your abnormal glucose levels? Well, you're going to see your elevated glucose levels in your diabetics because they either lack the insulin or they don't have enough. You're also going to see it with HHNS, which is the hyperglycemic hyperosmolar non-ketotic syndrome. There are lessons on both of those, so go check those out. Another time you're going to see it with pancreatitis because pancreatitis is going to disrupt that process of insulin production. You're also going to see it in patients with renal failure. Steroids, either through medication or through the problems with cortisol stimulation through like Cushing's disease or even stress, that's going to cause this one, and this one are all going to cause insulin resistance. The ways that this happen are extremely complicated. But the thing that you need to remember is that your patient is subject to stress or they're on steroids for some reason. Know that that could keep the insulin from working and that'll cause that glucose to go up. Now, there are a couple of situations where you're going to see decreased glucose levels. And if a patient has a tumor called an insulinoma, it actually, what it does is it causes this overproduction of insulin. And because of that, it's going to drive that glucose down. Also in cases of hypothyroidism and hypopituitarism, you're going to see it. You're also going to see it in cases of malnutrition. So they're not getting enough food and they lack energy. The other time you're going to see it is if they receive an overdose of insulin. So if they get, if they're poorly managed or there's they gave themselves too much insulin, you'll actually see that there. Basically, you use all the glucose up and there's nothing in reserve. So for this lesson, our nursing concepts focus on lab values and glucose monitoring. We're watching our actual lab for glucose. So let's recap. So the normal values are going to be 70 to 115 milligrams per deciliter. And remember that insulin is the key, and that gets the glucose from the outside of the cell into the cell. When you're taking care of your patient, it's going to be very common for you to do bedside testing. So make sure that you check out the glucose monitoring lesson for tips and tricks. And also most of your labs are going to include a glucose in all of that testing. When you see an elevated glucose, think that there's too much glucose in the blood and then we need to move it into the cell. That's the goal there. So patients that can't do this, they either lack the ability to utilize insulin or they don't have enough insulin. So you have some, or you potentially have some sort of insulin resistance. If you have decreased glucose, then think they either don't have enough sugar or they have this overproduction of insulin. That's it for our lesson on glucose. Make sure that you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.